So now, you can say he has a dominant. Now show that he has one.
So I'm going to reposition your legs here. Get them up. Then I feel like putting them across.
You can.
Then I'm going to check and look, see that he has a...
Well, you gotta fully do the leg thing, alright? So you position the leg.
Yeah.
Position the leg. Then you expose the abdominal wound. So you can show it.
Okay.
Show that he has it. So position leg, expose it.
Abdominal wound. I'm going to reposition the legs.
And then you turn head to the side. And then when you turn the head to the side, then it'll make it more visible that that's the injury right there.
I turn his head to the side. I see he has a laceration to the eye, right?
Yes. So you're going to check for cobbles.
Now I'm going to check for cobbles.
Alright. So it's just a laceration. He'll be fine.
Okay.
It's not life, limb, or eyesight.
Alright.
So you're done with this patient right here.
Okay. This is going to be...
that's the first part of your triage.
Alright.
Okay. Then you're going to move on to your next casualty.
That's going to be my delayed patient.
Female.
Oh, come here.
Okay.
Okay, you come up on her. Hold the arm.
I see you holding your arm. You got a fracture. Let's reposition it.
Alright, you'd be a no-go right there.
Okay.
Radial
First
pulse.
part of reposition. Check the pulse.
Radial pulse.
So, just remember, before you move it, check the pulse, and then after you do something to it, check the pulse.
Okay. Alright. I see you have a fracture in your arm. Let me check your pulse.
Pulses are present.
Okay. Now I'm going to move your arm, put it there in a better area. You check your pulse again.
Pulse is present.
Okay. Go ahead and hold that and support it right there.
Alright, there's bleeding on the face.
There's bleeding on the face. She has a head wound.
Check PMS.
Check PMS.
You can check PMS.
Oh.
And also, one more thing.
Squeeze
It's
your
something
hand.
to do with the eyes.
Oh, pearls?
Pearl and PMS.
Alright, so I'm going to check pearls and PMS. Go ahead and squeeze my fingers. Alright. Go ahead and put resistance on my feet, on my hands. Alright. Check your eyes. Okay.
Right. And then you're done with this one for triage. Okay.
Nice.
You can either tell her, hey, respond to me if I talk to you, or all you got to do is just talk to her later on when you go through that.
So every time I ask you a question, respond to me, okay? Alright, I'll be right back.
Okay. So you're done there. Then you come on to the, this is your airway patient. This is where you're going to stay in place for a little bit.
Okay, so I come in with the patient and I'm checking vitals, shock, and respiratory distress.
Yeah, I'm gonna when you get done. Yes.
Oh, okay.
All right. So first part here. Okay. You got your supplies ready. Your gloves are good. All right. You know what his injury is. Now let's go to treatment. Okay. So we expose the injury. Yeah.
Damn.
Gunshot wound.
All right.
So I'm gonna put my hand on it.
Yes.
Okay.
Then you're going to roll to check for
All right. So now I'm gonna roll him and look for an exit wound. No exit wound, or as you say that.
We'll tell you no exit wound.
Okay.
Okay. Then you'll treat the injury right there.
All right,
so you'll just get out your seal.
So I'm gonna put a seal on.
Slap it on right there.
Okay.
And then
the seal on.
All right. And then you put him in position. So you roll him in a recovery position.
Oh. So I need to put him into the recovery position. Roll.
All right. And now you assess those three things.
All right. Now I'm gonna check for vitals, respiratory distress, and shock.
Yes.
And I can see.
And then we tell you the patient showing signs of further respiratory distress.
Okay.
So that's when you're gonna roll him back down on his back.
Roll him back.
And then you gotta choose one of these two taps that you'd like to do.
Okay. So this is the needle.
There's one right behind you. Grab it. Okay.
All right.
So for that, okay.
So here I'm going to check for mid-clavicle.
Mid-clavicular.
Mid-clavicular.
All you have to say is, you can just say nipple line.
All right. And nipple line.
Second intercostal space.
Second intercostal space.
So as I said, like if you're having trouble finding it, come over here to the sternum, okay, and you'll feel you see two squishy areas, okay.
Right.
Choose the second one. Go over here.
To the nipple, right above the nipple.
Yes.
Okay.
And then just stick it there.
And I'm going to go in at a 90-degree angle.
Okay. Once in there, you hear a hiss and a pop. So you remove the needle, put it right back into that brown tin case thing, just so you don't stab yourself with it. Okay.
Okay.
And
now
then you will secure
I'm going to secure the NCD using tape And the pants method?
So you tear off a little bit of tape, tear it down the middle a little bit. And then, okay, and it's secured. And then
don't I tape this to him?
No, you don't have to, sir.
Oh, okay.
Okay. Then you come back over here.
Put him in a...
And you position him back in
now I'm
reverse.
going to try to put him in recovery position.
Okay.
I'm checking for vitals, respiratory distress, and shock.
Okay. And then we'll tell you that further respiratory distress.
Alright, so now I'm going to do the
NPA. Or you can say nasal pharyngeal airway.
Okay. NPA. So
Stick the tube thing in his
Stick
nose.
the tube in his nose.
I'm going to measure, pull out the...
Sorry.
So you check for obstructions. That's all that. You had your hand on the nose, so you check for obstructions.
I'll check for obstructions. I'm going to pull the NPA out of the bag. I'm going to measure from ear to jaw or ear to nose.
It's either nose to ear or nose to jaw.
Nose to ear or nose to jaw.
Yes.
Now I'm going to lube it up.
Okay.
I'm going to put my finger to give him the Porky method.
Yep, that works.
Alright, and I'm going to slide it back until it's flush with the nose.
Alright.
Okay, now I'm going to roll him into the recovery. Check for vital, shock, and respiratory distress.
Your patient's breathing fine.
Okay.
Okay, so you're done with this patient.
Okay.
All things are done. You leave it just like that.
Okay, so I leave him like that.
So now you're going to go to your second time around the circle. Okay. Done with here, pick up all your stuff, and you head over to the abdominal entry. Say hey. Okay. You get to the abdominal entry. Make it look pretty. In other words, you're going to press the entry.
Can I also say I'm going to...
You don't even have to do that.
Okay.
Just treat the injury. Cover it up.
Do me a favor, buddy. Go ahead, lift your hips up. Alright, thank you. Put it down.
Strong hip, press back for hip, down, hip, down.
Okay, that's 2 knots. Now I'm going to cut the ties. Now I'm going to treat his head by his eye injury.
You got that.
Using, is this called gauze, right?
Whatever. You don't even have to say what you're using.
Okay.
You don't even have to say that you're treating the eye range. You just do it. Alright? We know what you're doing out here. We've gone through the lane. We know the lane.
Yeah.
So, all we're testing is that you know what you're doing. So, make sure you tell them to close their eye.
Go ahead and close your eye for me. Alright, and I'm going to lift your head up as I wrap this around.
Doesn't have to be pretty.
Okay.
As long as you're not causing further injury by just tight. Okay?
Alright, now do I want to sit him up?
No, you're going to put his head back to the side.
Put your head and just go ahead and turn to the side for me.
Okay, and that's everything you need to do for this one.
Okay.
It's done. And now, you're going to go to your last casualty.
At any point in time when I'm over there to hear, do I say, hey, how are you doing?
You can.
Okay.
How
you doing over there?
I'm good.
Okay, I'm coming to you right now. Okay. Alright, so what we're going to do now is we're going to check your vitals.
Pulse is present.
I'm going to create this splint for you.
Right. Go ahead and unfold it and then create it so that you go through the motion of knowing how to do it.
Alright, so I'm going to do a measure there. So I'm going to create a handle here for you. Bend it for it to fit your arm.
Okay.
Go ahead and give me your hand. Put that on there. Keep supporting that for me. Alright, now I'm going to check your pulse again.
Pulse is present.
Alright, now I'm going to wrap the ACE bandage around it. Make sure that it's covered. Okay. Let me check your pulse one more time.
Pulse is present.
Alright, so now we're going to swing your arm, okay? Just so you don't have to hold it. Okay, give me your hand. Hold it out there. Okay. Find the knot here away from the wound. Now I'm going to put a swaddle around to keep it close to your body, okay?
Hey, tuck that in. Tuck that in.
So you gotta tuck in that
Tuck the corner.
the corner.
Do you have to do it? You can do it at the end, or you have to do it at that point.
You have to do it at that point.
Okay.
In order.
At least so you don't even forget also.
Hide the knot there for the swaddle. You check the pulse again.
Pulse is present.
All right.
Okay. Then you're done with the arm.
Now let me take a look at your head.
You've already checked Pearl and PMS, so all you got to do is dress it.
All right. So let me take this cap off for you.
So nice.
I'm going to just screw myself.
I want to be a patient out here just all week, just looking.
Huh?
I want to be a patient just laying all down home.
Been out here
Is this
for
covering your eyes?
3 weeks now.
Yeah.
Every day.
It's
Except
not.
for weekends.
Yeah, it's not
It's
fun.
exhausting.
Trust me.
I just want to do it though. Gives me out of work. Take a break.
Okay. Is that too tight?
No.
Okay.
All right.
All right.
And then you're done.
All right.
You gotta tell us
Then you got to tell the 5 pieces of information.
All right. Do I have to do like call sign or anything?
No,
Okay.
just tell. All you have to say is those 5 pieces of information.
All right. So setting up sit rep, medical sit rep. I have 3 American casualties. 2 that are going to require litter. 1 is ambulatory. 1 is immediate. 1 is minimal. 1 is delayed. No special equipment required.
And that's it.
Okay.
All right.
Let's roll.